So what are the muscle and nerve structures involved in muscle contraction and relaxation? There are two types of muscle fibers, the extrafusal fibers and the intrafusal fibers. The center of the intrafusal fiber do not contract because it doesn't have actin and myosin, whereas its ends will contract. The extrafusal fibers, they contract. There are two types of excitatory motor neurons, the alpha motor neuron and a gamma motor neuron from the spinal cord to the muscle fibers. The alpha motor neuron innervate the extrafusal fiber and form neuromuscular junction. And what chemical is released there? It's acetylcholine. The gamma motor neuron, they innervate the intrafusal fibers. There are two types of intrafusal fibers, the nuclear back fibers and the nuclear chain fibers. There are two types of gamma neuron, the dynamic and static. The dynamic innervates the spindles and a nuclear back fiber, and a static innervates the nuclear chain fibers. There are two types of sensory structures, the muscle spindles. The muscle spindles are in the intrafusal fibers, and the Golgi tendon organs are in the muscle tendon. See, the muscle spindles, when stimulated, cause stretch reflex. They are innervated by the gamma neuron that stimulate them, and they are inhibited by the pyramidal corticospinal tract. They are sensitive to muscle stretch or muscle length. When the muscle stretches, the spindles are stimulated and send impulses via sensory nerve to the alpha motor neuron, whereas the Golgi tendon organ is stimulated more by muscle contraction, but is also stimulated by the muscle stretch, and it sends impulses through 1B fibers. There are two main types of sensory fibers, the 1A fibers and 1B fibers. The 1A fibers arise from the muscle spindles and 1B fiber from the Golgi tendon organs. The 1A fiber that are stimulated by muscle spindles directly innervate the alpha motor neuron to cause contraction, whereas 1B fiber, they innervates the internuncial neuron, which are inhibitory. Excitation of these inhibitory neurons, the internuncial neuron, acts on the alpha motor neuron to inhibit the contraction, or it decreases the excitability of the alpha motor neuron. So this is the Golgi tendon organ. Through the sensory route, innervates the internuncial neuron, which is inhibitory, and stimulation of that causes inhibition of the alpha motor neuron, so the contraction is stopped. There are two types of inhibitory neurons, the internuncial neurons and the Renshaw cell. The internuncial neuron, when stimulated, they inhibit the alpha motor neurons. The Renshaw cells, they are the inhibitory neuron present in the anterior gray horn along with alpha and gamma motor neuron. So there are three motor neurons in the anterior horn cells. When alpha motor neuron is stimulated to cause the muscle contraction, it causes relaxation of the antagonist muscle. And this is when one of the twigs from the alpha motor neuron innervates the Renshaw cell. The Renshaw cell, which is inhibitory, sends impulse to the antagonist alpha motor neuron to cause relaxation. There are two types of gray horns. Anterior gray horn has three types of motor neuron. Two of them are excitatory and one of them is inhibitory. The posterior gray horn has sensory neurons that are connected to the anterior horn cell motor neuron via the inhibitory internuncial neuron. The inhibitory neuron in the anterior gray horn is Renshaw cell.